Hi, I'm Heather Barr, a registered dental hygienist, and I've worked in pediatric dentistry for about 13 years now. And I know that being in the quarantine situation for a few weeks has its trying moments trying to get our kiddos to do their schoolwork, but it's also difficult sometimes to get in new routines and good hygiene habits. So I just want to encourage all of you. I know exactly how it feels. We struggle sometimes to even get 2 brushings in each day. And I just wanted to review some of the techniques that I have personally found work, and I'm going to share with you some of those things with my 7-year-old son. So the first thing is, in the mornings, it's a good idea to try to brush early in the morning, and if they want to brush on their own, then that is fine. What I like to encourage is their independence, that they are trying to do this on their own. But just as parents, remember that it's usually not an efficient job. Their little fine motor skills aren't going to be super defined until they're around 10 years old, and every kid is different. Typically, we don't want them flossing on their own until they're able to hold the picks and not injure themselves. And up to that point, we really encourage you to be flossing for them. Now, the second brushing at night, we do encourage a tag team situation where they brush first with the toothpaste because the toothpaste tastes good and kind of encourages them to do so, and then the parent to follow up with just water. And the reason I like that is it's the mechanical action of the toothbrush cleaning the plaque from the teeth, not necessarily the toothpaste. So you as the adult are going to be able to target the areas that are most difficult for children to remove plaque and where they're going to have the highest concentration of cavities, which is on the top, on the outsides by their cheek, because they tend to go like this and tighten it up and it's hard to brush right there. And then on the bottom, it's along the tongue side, just because it's hard for them to get that toothbrush maneuvered so that the tongue is out of the way and that they're working all the way down to the base of the gum line. Okay, so I've got some products here. There's the floss sticks and the floss string. Typically what I like to do is we're going to brush in this setting, and then I like to floss Chase in bed when his head can be laid back on a pillow and stabilized. Otherwise, when you're flossing, it kind of like snaps them, and children tell me a lot that it hurts when their parents help them floss, and I guarantee it's not an intentional consequence. It's just because their heads aren't stabilized. So remembering what we do in the dental office is lay them down on the chair and work from the kind of the angle of coming from the top, and you also get better lighting that way. So all right, so I've got my son's toothbrush here. You want to just do a dab, like a pea-size amount of toothpaste. Now he applied it himself there, so you can kind of see that. Go ahead and hop up here, Chase. We're going to with a toothbrush, and why don't you come up?
Like here.
So one thing that I have found, kiddos tend to like to brush all around at the whim. And so one thing that I try to instruct Chase is
Mama?
to
Yeah?
So one of the things that I try to instruct is to create some kind of system. And for children, that is really difficult. They don't understand that concept of 2 minutes. So something that I like to say to him is make sure you're brushing each tooth. Even though we tell you to go brush your teeth, brush each tooth. You got the outside, the inside, and the top. The other thing is they tend to just roll it around. So you want to make sure that you're doing it light and quick. Do you need to spit? Okay, that's it. So hear that brushy noise? Let me hear it. So we're hearing a light and quick motion, and brushing your teeth 10 times versus brushing for 2 minutes, is going to be much more effective in their little brains because they can count to 10 on each area. Okay, so go ahead and spit it out, and Mama's going to show how we do it. Okay, so your time with your kiddo is gonna be limited, okay? They're ready to go do other things. So I just wanna show you, I sometimes will support his head up against me, and I make sure I am going light and quick and targeting those areas. Now also use your hearing. You should be hearing that brushing sound. You want to get at the gum line with a light pressure. It's more effective that you're brushing quickly and not pushing really hard. Do you need a spit? Okay, good job. We're gonna do the top. Okay, so turn this way. All right, so you want to be careful not to push it too far back. I make that mistake a lot, and I get the ow. So what happens is we get too far back and hit the back of the mouth. But I want to make sure that his cheek is not tight and that I can reach that. Okay, so we want to get the inside and get along that gum line really good. Okay, so go ahead and get a rinse, Chase.
I don't need to.
Okay, well, let's show them how do we check to see if the teeth are clean. What's the last thing we do with your finger? What happens when your teeth are clean? Look at the camera. Your teeth will squeak when they're clean. So he likes to check them. And you also want to teach your kiddos to, feel with their tongue. So look at the camera, show them how you feel with your tongue. So they can feel for any rough spots or any plaque that might be left behind. It's a good idea after they eat too, so they're not leaving Cheetos and crumbs and cookies in their teeth. They can kind of feel around. Excellent job. Give yourself a hand. Okay. But always watch the sugary drinks and snacks. Kids have a lot of access now. They're home all the time. So it might be good to organize their snacks in the fridge or in an area where they can reach the healthier snacks. If they want to have goldfish or chips or crackers, those are fine as long as they're not with them for an extended amount of time. So you want them to have like a timer so that they can eat and not just nibble and play and watch TV and go back and nibble, so that the amount of food isn't staying on their teeth for long periods of time. Something we really stress in our house is water. So he has access to water all the time. And then if he wants some strawberry milk or something, we limit it to meal times. So breakfast and lunch or dinner. But most of the time we like to choose water, and that's gonna help clean off the teeth after they eat. And it's also not going to be adding those sugars in between meals to leave it on their teeth. So thanks for watching, and I hope that helps with your smaller children. Remember, you should be helping check their brushing up until the age of 10. And sometimes if you're not physically brushing for them, you just want to make sure you're lifting their lips and checking that gum line. They can't identify the plaque yet. They can't see it. They don't know what they're looking for, and they don't even know that it's there. So they still walk around with food on their face and just don't have much self-awareness. So they really need your help to be able to get proper brushing. So have a great day.